Expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency servicing Miami, Broward, and Palm Beach County. You can reach us directly at 954-717-7027. I am your host, Louise Gomez. Welcome to the show. And today I am excited to introduce everybody to Dr. Alex Mafdali, who is the sports medicine physician right here at Baptist Health. Thank you for joining us today.
Thanks for having me, Louise. Really happy to be here.
Yeah, we're excited to have you because I know you got your hands in so many different things, so I'm excited to pick your brain a little bit. But tell us a little bit about your background. What made you want to get into this type of medicine and what intrigued you?
So I am an athlete my whole life. I grew up playing tennis, football, whatever I could get my hands on. Wasn't good enough to go collegiate, and unfortunately experienced some injuries myself that I think I kind of got a little intro to medicine.
I see.
In that aspect, in the recovery. My father is a podiatrist, my mom is a nurse.
Okay.
So our dinner conversation was definitely medical related.
Nice.
I went to undergraduate school at University of Florida. I had always had an interest in sports and knew I kind of wanted to be a physician from the get-go.
Good.
I went to medical school at Ross University, which is a Caribbean school at the time in Dominica, now in Barbados. And I was lucky enough after that to land a residency in the University of Connecticut.
Wow, nice.
And I'm born and raised in South Florida, and going to the cold
was
a little
shocking.
A little shocking, but you may do. And I learned some lessons, and it was a really nice time. And I have some family in Connecticut as well, so it was really nice to be able to be with them also.
That's great.
I think my exposure while I was in Connecticut kind of highlighted how involved a sports medicine physician is with the collegiate aspect, the professional aspect, and the high school, and how it could be a pivotal role to help athletes get back to where they want to be. And so I did my training as a family physician, a primary care doctor.
Nice.
And through that, dealing with comorbid conditions, I always felt gravitated to patients that wanted to get back to what they were doing and know how to take care of themselves, what exercises, and how to create a routine to keep them stable and going forward. As an athlete also, I was trying to see how do I merge those two together, and I ended up doing a fellowship at Baptist and FIU and was the primary care sports medicine fellow for the Dolphins, for the Heat, for Inter Miami, and a lot of the professional sports and collegiate sports, and lower levels as well, high school football.
Okay.
Yeah. So that kind of led me to have a great opportunity, be now the team physician for Florida Atlantic University, where I serve as head team physician, and really enjoy what I do and really enjoy my interactions. And I think it's a great symbiosis between Baptist Health, which has a good liaison with FAU that provides great medical care for not only their players, their coaches, their staff, and whatever it is they need.
Wow, so you got your hands involved in everything that you seem to enjoy.
Yeah.
You created that.
Yes, it was with hard work, but I do find myself doing what I enjoy and don't work a day because I enjoy it.
That's exactly right. And you know what? As a patient, we always want to meet a doctor who we kind of feel that. We want to, have that person who has that good energy, and we feel that as a patient, like, are they really listening to me? Are they paying attention? Is this important to them? And I feel like because you love what you do and it's so important to you that you you do that. Like you said, it's not work.
I really try to amplify that and try to show some component of that to my patients as well.
Yeah.
And I mean, if you ask any of my patients, most thing I get in the room and I don't talk. I kind of listen to what they have to say before I chime in, just to kind of get the opportunity to have them be able to say what's been on their mind before I get going and what I think I need to say, and meet them in the middle somewhere along the way.
I like that. So, Dr. Mafdali, a lot of our audience is maybe seniors, 50s, 60s, 70s, or older. And this is really imperative for us. I know I'm reclaiming my life back by doing my routines. So this is important to our audience because we really want to know about work, all these different, things that we're doing, changes in our body that happens as we physically, age, and how does that affect our approach to fitness as we're seniors? How does that affect us?
Well, I think it's important to exercise no matter how old you are and no matter how old or how young you are. I think start slow and just listen to your body. I think, I can relate. I'm the last of 5 kids.
Oh, wow.
And my most senior sibling is 20 years older than me. So that's mid-50s.
Yeah.
But my parents are also in their mid-70s. So I can kind of relate to siblings dealing with those, but also my parents going through similar aspects and help guide them, just like I guide my patients.
Yes.
So I think there's been newer research and newer studies that come out, I think out of Stanford, that said new changes that are identified are in your mid-40s and in your 60s. Biochemical reactions that are slowing down at an increased rate at those times in our lives. So knowing that at those times it may be a little harder to recover for certain things that we had been before. I think as we age, we have a decrease in bone mass, so bone density, decrease in muscle mass. We have a decrease in our ability to metabolize our food. We have, I think, so a lot of things start creeping up, and I think being cognizant and taking action on the front end can really ensure that your future is in good hands.
Yeah, and starting as soon as we can, and I guess it's never too late, but starting as soon as we can, because the bone issue is a big factor, because strength training, for example, who should do that? Like, what do you suggest? Because I know it's important. I have a resistance to it, but
there is. I think
who should
it's
do
twofold.
that?
I think adults are definitely able to maintain and start strength training. The recommendation from I forget which source, AFP, AMA.
One of those. Okay.
It's been 100. Well, for strength training, it's 2 to 3 times a week.
Okay.
Of incorporating strength training.
Okay.
In addition to cardiovascular fitness, which the recommendation is 150 minutes per week of moderate intensity activity. I think strength training in and of itself helps combat the innate muscle loss that we have.
Yeah.
And with time, we do lose muscle. And trying to put on as much muscle as you can earlier on to have more to lose down the road, I think sets you up for success.
That makes sense.
I think maintaining weight-bearing activities help our body absorb calcium and vitamin D to then prevent us from having osteoporosis, osteopenia, which can then lead to fractures when they may not have needed to be something fractured.
Yes.
Yeah,
I know I started my 20 minutes a day on my little rebounder, my little trampoline, and I will tell you, at first it was challenging, but now I feel the energy. So it works. I can tell you, I've finally been doing consistently.
I think that was a key. I think what you just said, consistently, is a major part of it. Because if you try something and met with undesired results, you stop. You try something else, you're going to continue this cycle. If you find something you really enjoy, I think you need to fine tune how to enjoy it without feeling too much aches and pains, but not feeling nothing, like you're just walking and didn't do an exercise. Yeah,
absolutely. So what are some common mistakes that people make maybe when trying to get in shape later on in life? Maybe like what would you tell the audience who maybe they've never done anything and they're like, I know I got to do this. I know you said start out slow.
Yeah. Well, there's a component of never doing anything, and then the people that had been doing a lot and had a prolonged pause, and then get back thinking they're exactly how they were.
Oh, yes, that's a good point.
And then starting with the same weights in the gym, starting with
That's
the same
true.
intensity with the expectation that they could do this.
That's true.
So doing too much too soon, not listening to their bodies, something's hurting them, continuing to do something, and it's continuing to hurt them, not getting better. Those type of things.
Sometimes in our minds we think, well, I did this when I was 25, right?
Case in point.
I can do this.
Right, but maybe not.
And
Maybe
then-
that
right.
may not be the best. Whether you could do it or not is not the fact. It's a matter of, can this lead to an injury?
True.
Are you going to overdo something?
Right.
Or, yeah.
Absolutely. So what about, what role does flexibility and balance, I've heard a lot about balance, what role does that play in healthy aging, and what exercises do you recommend for those types of areas, flexibility and balance?
All right, so flexibility, I think, is on the trend of things that decrease as we age. Our connective tissues are less elastic, right?
True.
So they may be a little more stiff, and trying to incorporate flexibility exercises and balance exercises in our day-to-day practice can help ensure that our joints are mobile and not stiff. That could then lead to other injuries. There are studies that Tai Chi is as
Yes.
effective for
Nice.
knee arthritis as compared to a physical therapy program. So Tai Chi is going through normal ranges of motions in controlled manners, guided and trying to be in tune with your body. I think that I really stress that. Yoga is a great opportunity. I think there are some limitations with yoga and
Sure.
these group classes that when patients do get into these structured programs, they're not like everyone else, and they may have certain limitations in certain poses based off certain problems that they have, and you just
Yes.
gotta know that, hey, that type of
Right.
exercise or posture is not for me.
Yeah, and every experience I've had in yoga, they always said, if you modify, if you can't do this, they give you alternate ways, because they know we compare ourselves. So we see the one, across who's doing all the stretching
That's
and whatnot. So the modification helps.
It's a problem also, comparing,
Yes.
right? Comparing to your previous self, comparing to other people. I think you just gotta think of where you were, what you're doing, and what direction you want to keep you in your own pace and not other people's pace.
Yes.
Regarding the balance, so balance is also paramount, right?
I've heard that
One
lately.
fall can really
Yeah.
upturn someone's life.
Yes.
And ensuring that you take day-to-day measures to keep your balance, to avoid a particular fall in a precarious situation is important. I think there are certain ways to try standing on one leg, try walking heel-toe, certain core postures, and making sure that you feel sturdy and that you are walking and being cognizant of what's in front of you.
So true. And I see a lot of these people on Instagram, and they're like, if you can do this, balance, this is going to indicate how well, you will successfully age. And I was like, interesting. I didn't realize that.
There are certain things like that. Can you get out of
Correlations.
chair just by standing
Yeah,
up?
right.
There are a lot of different things that can help indicate where you're at and help identify where you need to go.
Yes. Very good. And there's so much stuff online we can see. There's
Yes.
so many people.
But it's important to get vetted through your physician.
Oh, of
For
course.
sure. You can read a lot of stuff. I think
No,
that
of
the
course.
social media adds a lot to it, right? I think anyone with a voice can then put something, and then
Yeah.
people who have a big following that without the medical
True. Good point.
back behind that, oh, a good following, this person's this, they follow this, but
True.
it could be wrong.
No, you're right. Absolutely. You got to see Dr. Mafdali so he can figure that out. So when you see a patient, do you suggest, I guess, if they tell you, I'm having these troubles, do you suggest certain exercises for them?
I do.
Nice.
I usually, patients that come into my office end up with some exercise program, whether
Okay.
that be a home exercise program that I print out with a sheet of papers with how many
Nice.
reps to do, how often, for how long, or very often I refer to physical therapy.
Oh, okay.
Physical therapists are really good at what they do.
Yes.
They do their evaluations, and they are someone that you're seeing multiple times a week
Yes.
for this injury, as opposed to the doctor that you're seeing intermittently, and are able to take an assessment and decide, is this patient progressing in the direction that they should, or is this a place to pause, should we reach out to the doctor and maybe this isn't the right direction or something else is going on.
Yeah.
Plug in, my wife is also a physical therapist.
That's good though. So you can, work in conjunction
We
with,
do.
with each other.
Yes.
Yeah, because certain things that would be recommended to a PT that are going to be the best for them.
Without any conflict of interest.
Yeah, and also it's good because then they could see the progress, monitor that progress too,
I think
right?
the conversations that I have in the office are that I try to equate it to a personal trainer. They're not personal trainers.
Sure.
But most people go on their own volition to hire a personal trainer to start weight training. But if you have an arthritic condition or something that's limiting you, there's certain muscle groups that should be targeted in a therapeutic manner rather than just
Right.
going for your beach body muscles.
Makes sense. Yeah. Yeah, everybody wants those beach body muscles, right? It's like, I want that. This is what we can talk about. So how should somebody adjust their exercise routine after maybe recovering from an injury or dealing with chronic conditions? Since you're on this football team and whatnot, so when they have an injury, and they come back, what is that like as far as, well, we'll take that. We got a commercial break.
Sure.
We'll do that right after. We'll be right back, everybody.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Yes, we are back. Thank you for tuning back in, everybody. I am with Dr. Alex Mafdali, and he is the sports medicine physician right here at Baptist Health, amongst many other things that he does and hats that he wears. So, Dr. Mafdali, we were discussing as far as recovery after an injury. Maybe you want to speak into that a little bit.
I think as the theme goes, as we get older, things take longer.
Yeah.
And so do recovery as we get older. I think it is a problem because some people have the expectation, I want to get back and better yesterday, and some things just take time.
Yeah.
Most people come in and be like, oh, I don't have a fracture. Fractures heal well versus a sprain, which can take a little longer.
Oh.
I think it's a little different when dealing with athletes who have the day-to-day care of an athletic trainer who is a
Sure.
liaison between a physician and the player and the coaches to help guide, and they're the true medical professionals on the field with them on the day-to-day and kind of direct their care. So they have this extra TLC and extra guidance in real time, day by day, instead of saying, okay, wear a boot, come back in a month to see how you do. Sometimes it may progress a little quicker with more dire needs up front as a game coming up that they need to be ready for. And if not, that's okay, but at least we want to make sure we provide every effort that they do get better in a reasonable time, versus someone with injury who already has a chronic or comorbid or degenerative condition may not recover in that time frame that they think, and may need a little extra help, maybe need other modalities, sometimes injections.
I was going to ask you about those. Can you tell us about some of those
yes,
modalities?
Injections, well, modalities is typically physical therapy, immobilization, focusing on regaining whatever range of motion was lost, and then regaining whatever strength was lost, and then increasing from there. Injections, I think, there are many different types of injections. I think the more ubiquitous injection that people know is cortisone, which is a steroid that gets injected, whether it be into a joint or in a area between planes called a bursa. But there are other novel injectates, platelet-rich plasma, PRP.
The PRP, yeah. Been
Bone,
hearing that a lot lately.
yes, you do. I'll get into that. There's bone marrow aspirate concentrate.
Oh.
There's essentially similar. So platelet-rich plasma is us taking your own blood from your arm, like you would donate blood, and putting it in a centrifuge and trying to harvest, well, harvesting the platelets, and then reintroducing those platelets back into the area of concern with the hope that it repairs a little bit better and promotes all the healing factors as like a Honar signal to promote the healing.
I've heard a lot of good
There is.
people who have
I think
had
it's
good
safe,
results.
and there are good results. Sometimes it doesn't provide the result that everyone's
Sure.
looking for, and I think before anyone's pursuing any of those type of injections, having that understanding is important.
Yeah, and the expectations.
Correct,
right.
and having those conversations, and okay, if this doesn't work, what else can we try? There are a whole different type of injectates, like you can use micronized adipose
What is
fat,
that?
so essentially like a liposuction-esque, where you can take fat, minimally manipulate, and then re-inject that into areas to help as a cushion.
Like in between bones?
Particularly, yes, in between.
Nice.
Yeah, and into tendons as well.
Oh.
Yeah, so
There's a lot of options.
there are a lot of
now.
options. So I think talking with a well-vetted healthcare professional about the options available outside of just cortisone is helpful for these injuries. Sometimes doing these acutely during an injury are more beneficial than, oh, I have this injury, and then 4 weeks later I come to get seen.
Right.
Sometimes that can play in.
Sure.
But I mean, the body is a very powerful machine that is able to heal itself.
I know.
You know, other modalities are not. It may not heal exactly how you want, but the body does put you the direction you need to go.
It's so smart. Our bodies have that innate intelligence of just always wanting to heal. It's miraculous, if you ask me. It's just absolutely unbelievable. Let's see. Let's talk about other things such as sleep and other things that people may not think that it has a factor into their healing. What are some other things? Yeah.
So sleep, nutrition, hydration.
Yeah.
I think most people should, as we age, we lose our thirst type. You don't know you're truly dehydrated. That's why it's important to make sure you drink water before you're actually feeling thirsty. Nutrition, I think I am a believer in unpackaged foods that you should be eating.
100%.
I kind of recommend my patients at first to shop on the perimeter of their grocery store and then go directly into the aisle for the packaged item that they crave, rather than looking at what they want and putting in their cart.
Yes, whole foods.
Yes, I think sleep is paramount as well. We need more sleep, but we don't. Some people that I hear don't sleep longer as long as they want, but trying to know that as all these things are taking more time, we need more time, more recovery, maybe a little longer rest day, a little longer recovery before we feel that oomph and courage to get out there again.
Yeah. And I heard as we age, I guess we don't, or maybe you just said that, we don't hydrate as quickly, right?
Yeah, we don't. I think
Wow.
the other ways
Good
you
to
can
know.
look at your urine.
Yes,
If your urine
true.
is yellow, you know you're dehydrated. It should be that clear yellow tinged.
Makes sense. Definitely makes sense.
Oh, hold on. One other thing.
Yeah.
Protein intake.
Yes. Okay. Please. Let's
Yeah,
talk
I mean,
about
if
that
we're
'cause
talking the
we're
nutrition,
talking
yeah.
muscle.
So we're losing muscle. Our goal is to increase our protein intake. I don't know the exact specifics of the
Sure,
grams
but
per, but definitely want to know, or I do, but it's not offhand.
Okay. It's all good.
You want to make sure that you're focusing on that, focusing on anti-inflammatory diets, possibly if you have any component of inflammation.
Sure.
I've read studies of turmeric being added to your
Yes,
diet that can
I
help for
have
joint
as well.
mobility and inflammation.
True.
Eating clean, really.
Yes. Yes.
Lean, yeah.
We actually have 1 minute left, if you can believe it has gone this
Really?
fast. Yes. So, any last minute things you want to tell our audience? Do you want to have a call to action? Any type of maybe feel good story?
Sure, yeah. One, I just
Floor
want to
is
thank you
yours.
for the
Oh,
time, for being here. I
absolutely.
really enjoyed it.
Absolutely.
I think it's just important to find a doctor that you are able to connect with, that knows that they have their best interest for you and able to walk you through systematically how to get you back to what you're doing, knowing that if you're met with frustrations, there are other options. Maybe one doctor in and of itself, but a doctor that has connections with many other doctors that are able to
that.
answer your questions collectively
Yeah.
are really important to have in your back pocket. I think having the time with your doctor, I am really emphasize that I try to spend as much time with my patients as I can. Sometimes that creates a little longer waiting, but I give that to every patient, and just know that if there's any complaint orthopedically, non-orthopedically, if there's anything I could help any patients looking to get seen or heard or just be listened to or meet a doctor with advice, I'm happy and open and available to see new patients.
Well, we appreciate that, and we feel that Baptist Health does offer that to the patients. So thank you so much for being on the show. We appreciate
Yeah,
you.
thank you,
Have a
Louise. Yeah,
wonderful
you too.
evening.
Thank you.
Absolutely. Take care, everybody. Have a great night. We'll see.